Today, we're talking about Gadavist 2 mol/2 ml, 1 mol/ml, intravenous solution. This medication is used before a magnetic resonance imaging (MRI) scan to help make clearer images, so your doctor can more easily diagnose your condition. It belongs to a class of drugs known as gadolinium-based contrast agents, GBCAs. It's important to follow your doctor's instructions on the daily dosage and the optimal timing for taking this medication. Before starting this medication, make sure to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your healthcare professional for more information. Gadavist 2 mol/2 ml, 1 mol/ml, intravenous solution is given by injection into a vein by a healthcare provider, as directed by your doctor. The dosage is based on your medical condition and weight, so it's important to follow your doctor's instructions carefully. The benefits of Gadavist 2 mol/2 ml, 1 mol/ml, intravenous solution include its ability to help healthcare providers see clearer images during certain medical tests. The daily dosage and the optimal timing for taking this medication should be determined by your doctor based on your specific medical needs. Side effects of Gadavist 2 mol/2 ml, 1 mol/ml, intravenous solution may include nausea, unpleasant taste, or headache. If these effects persist or worsen, inform your healthcare provider. It's important to note that this medication has been prescribed because the benefit to you is considered greater than the risk of potential side effects. Most people using this medication do not experience serious side effects. However, it's important to seek medical attention if you experience any serious side effects, such as changes in the amount of urine, pain/swelling/redness at the injection site, or swelling of the ankles/feet. Additionally, seek immediate medical help if you notice dark patches on the skin, hardening/tightening of the skin, joint stiffness, hip/rib pain, muscle weakness, or trouble moving. While rare, a serious allergic reaction to this drug is possible. Seek medical help right away if you experience symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. This medication has the potential to cause kidney damage, especially in individuals with pre-existing kidney issues, elderly individuals, or those with high blood pressure or diabetes. It is important for your doctor to assess your kidney function before prescribing this medication. Be sure to consult the side effects section for more information. Before using Gadavist 2 mol/2 ml, 1 mol/ml, intravenous solution, it's important to tell your doctor if you are allergic to it, or to other gadolinium-based contrast agents. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Before using this medication, it's also important to tell your doctor about your medical history, especially if you have kidney disease, diabetes, or high blood pressure. Gadolinium can stay in your body for months or years after getting this medication, but studies have not found harmful effects if your kidneys work normally. It's important to talk to your doctor for more details. Before having surgery, it's important to tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. This medication may pass into breast milk, but it is unlikely to harm a nursing infant. It's important to consult your doctor before breastfeeding. It's important to be aware that Gadavist 2 mol/2 ml, 1 mol/ml, intravenous solution may interact with other medications, which could affect how they work or increase the risk of serious side effects. This is not a complete list of all possible drug interactions, so it's crucial to keep a record of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare professional before making any changes to your medication regimen. If someone has taken too much Gadavist 2 mol/2 ml, 1 mol/ml, intravenous solution and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, while in Canada, residents can contact a provincial poison control center. It's important not to share Gadavist 2 mol/2 ml, 1 mol/ml, intravenous solution with others. Before using this medication, you may need to undergo lab and/or medical tests, such as kidney function tests. It's important to keep all your medical and lab appointments and consult your doctor for more details. This medication is administered as a single dose before undergoing an imaging test. This medication is typically administered in a medical facility and is not meant to be stored at home. It is used as a contrast agent for diagnostic purposes during certain medical imaging procedures, such as MRI scans. The dosage and timing of Gadavist 2 mol/2 ml, 1 mol/ml, intravenous solution will be determined by a healthcare professional based on the specific medical procedure being performed. Be sure to follow their instructions carefully for the best results. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.